later at a later date, recording in progress, so that they will have access to it then. And once again, thanks to Kimberly Bassey Cook from Seton Hill University in Pennsylvania, who is hosting us today, because I don't have those capabilities. So we all owe her a big one for this. I keep hearing that buzz come in. So there's lots of people joining us, and that's fine. What we promised for today was to talk about ESAs, psychiatric service animals, and how they intertwine and go together and mesh, etc. And again, as a, two other housekeeping things. Number one is Kimberly is going to monitor the chat. And periodically, if I see something come up on the chat, I may stop and ask her if there's a question that needs to be addressed. I'm not going to be responding to the chat as we go along. I get confused easily. Secondly, we will be done at 1 o'clock because we promised that we'd make it an hour and that you guys could get back to what you need to do, which I know is a lot on campus these days. So with that having been said, this whole thing came about as a result of a conversation on the ICU list that dealt with, excuse me, ESAs and psychiatric service animals and service animals in general, and how they overlap, and the problem that most all of us are seeing right now in terms of more and more students coming forward and suggesting that they have psychiatric service animals. And we see it very often in response to things like the student who applies for an ESA is turned down for the ESA and shows up on Friday and shows up on Monday and says, oh, this is a service dog, or this is a service dog in training. And because somewhere along the line, they figured out that you can't ask the same questions or demand the same things from them if it's a service dog. Or you get the students who bring an animal to campus and claim that it is a psychiatric service animal when you know that it's not a trained animal, because it's really only 3 months old and it's barely housebroken, if at all. And how do you deal with that? And there were some statements thrown out on the list the day with it, the whole conversation arose, where somebody said, we know it's not real, but if they use the right words, if they use the word task, if they say PTSD, there's not a whole lot we can do about it. Yeah, there is. And that's what we're going to talk about today. We're going to talk about how you deal with some of those issues as they come along. I will also tell you, I did some prep to get ready for this session today. And I am going to be sharing with you some quotes that I pulled out and some ideas that I have for wording on how to say no along the line. You don't have to worry about writing them down as fast as I'm saying them. I have these in a document. As soon as we get finished with this session, I will put that whole document up to the ICU list and you can copy it down from there. So listen to what we're saying today. Don't worry about writing it down. You'll have access to it later. Okay, with that in mind, let's talk about, I gave you an agenda of what we were going to talk about today. And I want to kind of run through that agenda, stick to it as much as possible as we talk about these things. And the first issue was ESAs. You know what an ESA is, or at least what it's meant to be. But if you forgot why an ESA is, it makes it hard to figure out how to say no when no is the appropriate answer. We have gotten into the bad habit of assuming that because there is that funny wording in the HUD guidance that says full benefit or enjoyment of the housing facility, that anybody who says this is an ESA and brings you documentation of a mental health disability must be allowed to have that ESA, because if they say, I need it to be comfortable here in housing, then the decision is over. No, it's not. ESAs are, by that same set of HUD guidelines back in 2020 that says full benefit or enjoyment of the housing facility, it also says that the ESA is there to provide therapeutic support. I would have preferred that they use the wording from the old guidelines that talked about mental health disabilities. They didn't, but it does repeatedly use the phrase therapeutic support. So you are entitled to look for and to establish a legitimate tie between having the animal there and a significant mental health disability that requires the need for something for the animal in order for it to be, in order to have that full benefit and enjoyment along the way. In other words, they need to establish that, number one, this is necessary, that they have a disability and are covered under the law that makes them eligible to have it. Number two, that the animal is fulfilling a purpose, not just keeping them company. And there is specific language that says ESAs are not pets. And so if the discussion has to do with, this is the one I want because I've had this pet for years and years, and or if the documentation speaks about bringing their pet with them, you have reason to question whether it's necessary or whether they just would like to have Fido with them at school. It is not meant to be a pet. Now, there's a tricky issue there. I just dealt with this last week with someone where the fact that they've had it for years and it's their family pet could work against them in terms of whether or not you're going to allow it as an ESA, because ESAs are not pets. And if that's the only thing it's got going for it, the answer might be no. On the other hand, I had somebody whose documentation or whose rules regarding ESAs said, if you haven't had it for some time and been working with it, it doesn't count. In other words, they were against a student obtaining an animal for purposes of serving as an ESA and providing that kind of support. I would say you can't have it both ways, but the answer is you can't. Either one of those is a legitimate argument under the circumstances. The issue ought to be not where the animal fits in on the scale of have they had it, have they got use for it, etc. I want to know whether the student really has a need for some kind of therapeutic support from an animal, any animal. I'm more concerned about the student than I am about the animal as far as that piece of it is concerned. And I use this phrase when I'm talking to people on the phone about it, when they call me and say, I'm not real sure that this documentation is on the up and up that's been sent in support of this student for an ESA. My first question is always, did you talk to the student? Yes. Is this a student who really like to have Fido with them because they'd be more comfortable, or is this student a hot mess? If the student is a hot mess, technical term, if the student is a hot mess and there is no question in your mind that the student is going to be on the edge if they don't find some ways to cope with whatever it is they're dealing with, then I'm less concerned about the appropriateness of where the documentation came from and more concerned about making sure that that the student gets what may be a necessary support. Okay, so yes, you do get to say yes or no for an ESA. And we go into much more detail about the circumstances in which you say yes or no in the class that I teach. But I want to talk just real briefly about what you do with the weird requests for ESAs. Last week on the ahead list, there was somebody who wanted to have 4 millipedes and a frog as their ESAs. And people were seriously considering this. There was some discussion about, well, if that's what gives him comfort, then that's what we need to allow. No, you don't. I'm going to give you the wording that I would suggest, something along these lines that I would suggest for dealing with requests for a weird ESA. Quote, typically, we only approve commonly domesticated animals, such as dogs or cats, as ESAs, suitable for life in the residence hall. We will consider requests for other animals if there are extenuating circumstances, but health and safety concerns often preclude approval for other animals. That's what I would say to the individual who brings you 4 millipedes and a frog, or who brings you, I dealt with one just last week, the HUD guidelines say, make a differentiation between commonly domesticated animals and exotic animals. and say, generally exotic animals aren't good. Well, this person was, I think, from South Carolina. And in South Carolina, they don't consider ferrets to be exotic animals. And she said, so how can I say no? And I said, because it's not a commonly domesticated animal, and because there are rules, there are problems with ferrets in the residence hall in terms of escape, in terms of disease, in terms of behaviors, etc. You don't have to say yes simply because you can't clearly show where it said you don't have to. It's a judgment call, and it's a judgment call you get to make. And again, my wording is always, typically we only approve commonly domesticated animals such as dogs and cats as ESAs suitable for life in the residence hall. We will consider requests for other animals if there are extenuating circumstances, but health and safety concerns often preclude approval for other animals. You're not saying we won't talk about it. You'll talk about it, and then you'll say no. Okay. Let's talk about how you say no to an ESA. If you've done that review of what they've asked for, not just which animal, because that's a separate piece, but for the student who brings you faulty documentation or obviously faked documentation, or for whom the documentation does not indicate that there's a real need, and where your conversation with the student says, no, this is not necessary along the line. How do you word that no to an ESA? Again, I'm going to send you this wording afterwards. The purpose of an ESA is to provide therapeutic support for someone with a significant mental health disability living in the residence hall. Based on the documentation you presented to date, I don't believe there's adequate support for your request to have an ESA. Okay, the one thing I'd change there is I'd probably make that we don't believe. I'm always in favor when you're giving a no response to word it in the plural and put the weight of the institution behind you. It's not you, it's we don't believe there's adequate support for your request to have, to have an ESA. That doesn't tell them what it is within their documentation that you're saying no to. That's on purpose. If you tell them, we don't believe that the person who sent your documentation knows you well enough to make this statement, they're going to either argue with you or get a more detailed statement from that same provider that's harder for you to argue with. You're not arguing anything. You're saying, based on the documentation you presented to date, we don't believe there's adequate support for your request to have an ESA. And then you stop. And when they come back at you and say, but my provider said I should have this and blah, 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 your answer is, based on the documentation you presented to date, we don't believe there's adequate support for your request for an ESA. You just keep saying the same thing over and over. Now, there will be times when you have to expand on that answer, but that should be your basic premise. You keep coming back to the fact that you have considered their documentation, you've looked at everything that they brought you, and you made a decision, and the decision is no. Okay, questions? So I haven't seen anything pop up, so I'm going to keep going. What about service animals? You know what a service animal is on paper, but many of you are too intimidated by what you believe the rules to be to actually focus on the word service in service animal. One of the comments that came by during this discussion last week talked about service animals who can fulfill so many different roles as police dogs and fire dogs and search and rescue animals, etc. Those are not service animals, people. Those are working dogs. They certainly have a purpose. But service animals, the term service animal means a dog that is trained to provide disability-related service for somebody with a disability. Service animals is only used, and we're only going to use it in that context. It doesn't refer to working dogs in general. Quick note about dogs. Yes, I said service animals are dogs who provide. Some of you may be in states where your state law picked up the screwy reference to miniature horses. In the class, we talk about why that's not a consideration, but I'm willing to bet that there is no one sitting in on this conversation who has had somebody show up with a service horse to live in their residence hall. So until such time as it becomes a legitimate issue, we're not going to deal with it here. Service animals are, by definition, by DOJ definition, dogs. Okay. Legitimate, the key there is trained to provide a disability-related service. All of those words are important. Trained, disability-related service. You will get some of the students who show up with the pseudo psychiatric service animals who will show you the certificate that says they have been through public access training, AKA public access training. That means that they're good to go out in public. That's just fine, but that's not the training that the DOJ rules refer to. That doesn't make it a trained service animal. The fact that it has been trained by a legitimate trainer to be well behaved is terrific, but that's not the training that goes into it being a service animal. A service animal is trained to provide a specific disability-related service. It's got to be something that focuses on what that person with the disability needs in that context. I'm trying to think where to go from here because I'm looking at my own notes. Let's talk, we know that the easy examples as far as service animals. We know about guide dogs. We know about hearing dogs. We know about service animals that are trained to assist people with mobility impairments. What would a service animal be trained to do for somebody with a non-visible disability, specifically for a psychiatric service disability? By the way, one of the other categories of legitimate service animals is a diabetic service animal or a seizure support service animal. And you get into all sorts of questions along the way about, periodically you'll have somebody who tells you that their dog can predict when they're going to have a seizure. And the rules say seizure response dogs. And so their dog is trained to predict when they're going to have a seizure. Number one, you can't train a dog to predict a seizure unless you can have a seizure on request. Number two, there are dogs who appear to be sensitive to changes in electrical and chemical activity and who do respond prior to a seizure. They are not trained to do that. That's an innate behavior for that animal. The reference to seizure response dogs is just that, a dog that responds when the individual has a seizure. The dog is trained to do something in response to some behavior on the part of the individual. That's going to be important when we talk about psychiatric service animals. Okay, I saw a comment come up. Is there a question, Kim?
Yeah, we have two. One is on ESA documentation. A student, they received documentation that says the student has a qualifying disability that causes significant impairment, and they require an ESA to mitigate that condition. However, no diagnosis, description of symptoms. Are we allowed to?
I'm gonna stop you there. We're not going to talk about documentation for ESAs at this point in time. Whoever sent that in, I have a whole packet of stuff that I can send you about how to deal with documentation issues, but that's not pertinent for today.
Okay, next. Student claims she has a service dog that says she will take with her to help monitor her blood sugar levels. Would that be legitimate?
Yes, there is such a thing as a diabetic service dog. Those dogs are specifically trained to recognize changes in the smell of the individual, the chemical smell. Now, yes, it is a legitimate task. Yes, there are legitimately diabetic service dogs out there. Whether the dog that they're dealing with has been appropriately trained is something you can't know, but that's going to be one of those sticky issues. There are legitimate diabetic service animals. There are also some illegitimate organizations that pretend to train diabetic service dogs and don't. That we can't control for.
So I'm going to do an unpaid plug.
Yeah, go ahead.
Some of the questions that are coming in really are in that fantastic beasts and not where to find them course that you do. So just in looking through this, but the ESA language in the document and on how to word it when they're asking for multiple cats and multiple animals. Again, it's one animal. Right?
Okay, yeah, and again, that's something we're not going to deal with in detail now, but I will just tell you that when you get requests for multiple animals, the standard response is going to be in your policy. I would have something that says generally only one animal is approved per housing unit. When you get requests for multiple animals, the answer is generally only one animal is approved per housing unit. And when they say, but I need these two to do different things, etc., the answer is generally only one animal is approved per housing unit. It's their responsibility to show you why more than one would be necessary, which is going to be almost impossible for them to do. Because when it comes down to that HUD guidance that they're all referring to, there is no reference to animals, plural. It refers repeatedly to the animal, an animal, one animal, one animal. ESAs are one animal, except in extraordinarily rare conditions. And we'll talk about that more at another time. Okay, can we go on?
Last one is professionally trained versus self-trained.
Okay, that's exactly where I'm at in my outline. So let's talk about professionally trained versus self-trained. The DOJ guidance in 2010 and then updated with the 2015 Q&As talked about self-trained service animals. They left in the reference to self-trained service animals because there were a lot of people who could make do, who could use a service animal effectively as a service animal, and yet couldn't either afford or couldn't get access to a professionally trained animal because there aren't that many legitimate service animal training sites out there. So they left open the possibility of a self-trained service animal. That doesn't mean that, think about it in terms of, can you see where someone who is blind could train the dog with help from people around them, etc., to do what they need to do to help them at home? Or somebody who is deaf could train their own dog to respond to sound in the environment in a certain way. That's dog training that has to do with the individual showing and demonstrating and providing a Pavlovian response and kind of thing to what is going on. It is possible for people with some kinds of disabilities to train their own animal. I maintain that it is almost impossible for somebody to self-train a psychiatric service animal, because what the animal needs to be trained to do is to respond to behaviors that are out of control and do something about it. And the individual who is in the midst of those behaviors is not going to be in any position to train the dog. So yes, self-trained service animals are legitimate as far as the Department of Justice is concerned. That doesn't mean that anybody who says, I'm going to train this animal myself, is legitimately training a service animal. We'll come back to that in a minute. I want to go back and pull out someplace here. I want to talk about the actual definition of service animals out of the 2010 DOJ guidance, which is what we use. Service animals are defined as dogs that are individually trained to do work or perform tasks for people with disabilities. Again, individually trained. Examples of such work or tasks include guiding people who are blind, alerting people who are deaf, pulling a wheelchair, alerting and protecting a person who is having a seizure. Okay, alerting and protecting. That doesn't mean alerting, telling them it's about to happen. It means alerting to the seizure. It's responding to the seizure. It's a wording issue that was in there. Reminding a person with mental illness to take prescribed medications. Okay, that's always seemed to me to be silly. And it's one of those issues that you get, that's one of the tasks that you'll have people come back to you and say, this is my psychiatric service animal, and he's going to remind me when it's time to take my pills. And that makes no sense in terms of what is the dog responding to that you're not responding to, as far as an alarm. Are you telling me this dog knows how to tell time and can say 1 o'clock, sucker, it's time to take your meds? It's not going to work that way. I realized as I was preparing for all of this that by definition, when you talk about a service dog being trained to do something, the service dog is being trained to respond to some behavior on the part of the disabled individual. And if the individual is starting to sweat, is starting to glaze over, is starting to shake or whatever, the dog may respond to those behaviors on the part of the person with the disability by alerting them to medication, by getting the medication, by nudging them in a certain way that they've been trained, et cetera, by bringing them what's there. When it says reminding a person with a mental illness to take prescribed medications, they're not talking about doing it on a schedule. They're talking about doing it in response to something that the individual is showing that the dog is responding to and saying, whoa, wait, time for your meds. Okay. Calming a person with post-traumatic stress disorder during an anxiety attack. All right, let me finish and then I'll come back to that one. Or performing other duties. Service animals are working animals, not pets. The work or task a dog has been trained to do, to provide, must be directly related to the person's disability. Again, general public access training doesn't count. Dogs whose sole function is to provide comfort or emotional support do not qualify as service animals under the ADA. Okay, how do you balance dogs whose sole function is to provide comfort or emotional support do not qualify as service animals under the ADA with the earlier statement about the task being calming a person with post-traumatic stress disorder during an anxiety attack? Isn't that providing comfort or emotional support? No, it's not. Those are very different issues. When they talk about calming a person with PTSD during an anxiety attack, they're talking about the dog taking specific actions in response to specific triggers on the part of the individual with the disability. This was a part of the conversation that we had last week on the list where somebody talked about how is the dog putting his paw on your leg. Deep pressure massage is a fake. That's not a legitimate service animal task. Then how is putting pressure on your leg a service animal task, or nudging up against the individual? Aren't they just calming them down? Aren't they just providing comfort or emotional support? No, not if they are doing those things specifically because they have been trained to respond in a certain way to a specific behavior on the part of the individual with the disability. Service dogs, legitimate service dogs, are not trained to provide service to anyone who's blind or to anyone who, a guide dog is not trained to provide service to any blind person or is not trained to provide service to anybody in a wheelchair. They are trained to provide the specific service for the specific individual to whom they are assigned, because that individual will use different cues, will need different kinds of service, etc. So if you've got somebody with PTSD who has a psychiatric service dog, the dog may be trained to respond to certain behaviors on the part of that person with PTSD by doing certain things. And one of those things, the reference is to grounding, is to come over and put its paw on your leg and say, yo, hello, don't go off into Never Never Land here. I'm here. Come back. Be here. Think about what you would do if you saw somebody, if you had a student in your office who looked like they were getting ready to lose it. Wouldn't you lean over and touch them physically and establish contact to try and bring them back to where you're at? That's what the dog's been trained to do. That's a legitimate psychiatric service animal task. Yes, people with PTSD may have psychiatric service animals, but those animals are not there to provide comfort and support, or at least not solely to provide comfort and emotional support. They are there to respond in an emergency in a certain way. They have been trained, and training is the key. Okay, I'm looking at my notes. We have a question.
One question while you're looking at your notes. Should the service animal be with the person at all times, or can they pick and choose?
Okay, that's also on my notes. See, good cue. We get into this argument periodically on the lists when somebody says they've got somebody who says they're not going to keep their service dog with them all the time. They're only going to have it with them at certain times when they need it. For purposes of your students on your campus, that is going to generally be an unacceptable statement regarding a service animal. It is not a service animal if it is not with them providing a service, which means that if it is a service animal, if they're bringing it to campus as a service animal, then it needs to be with them in order to be providing a service. The dog doesn't have that status by virtue of what it's been called. It has that status by virtue of what it's doing. If it's not with the individual, it is not providing a service. Therefore, the understanding is that service animals will always be with their owners. Now, there may be specific, unique circumstances in which it's better for everybody if the animal is not with them. And I remember years ago, a blind student who was in the marching band who chose not to have their service dog with them when they went to football games because the noise and the confusion and 80,000 people stamping on the stands was absolutely demoralizing for the dog. It was just not workable. And it made perfect sense for them to leave the dog in someone else's control during those football games. So there may be times where, or if the student's got one class where there's another student who has a severe allergy and they can't figure out another way to do it, and the student with the service dog says, okay, I'll leave the dog someplace else during this one class. There may be exceptions, but for the student to say that regularly, I'll take the dog with me when I need it, but I don't need it all the time. The answer is, if you don't need it all the time, you're not using it as a service animal. And so the answer is no, the dog must be with you at all times. I pulled out a quote from the 2015 Q&As about service animals that the Department of Justice put out. One of the questions asked was, are hotel guests allowed to leave their service animals in their hotel room when they leave the hotel? And the answer is no. The dog must be under handler's control at all times. That's as close as a statement from the feds as you're going to find to the issue of, does the dog always have to be with them? But the answer is yes, damn it, the dog has to always be with them. It's not providing a service if it's not with them. If you have those unusual or unique circumstances where you are willing to allow the student to leave a service animal, to not have the service animal with them in unique, limited circumstances, then I would make it very clear that in those circumstances, the dog must, if the dog is staying in their room, the dog must be crated or kenneled in the same way it would be if it was an ESA. And if it whines or creates a disturbance or whatever, it will be dealt with in the same way it would be if it was an ESA that was disruptive, and it will not be allowed to stay. Bottom line is, yes, the dog has to be with them all the time. Okay?
And Alexa provided a nice example in the chat about nocturnal seizures, and that the dog alerts others by hitting an alarm in the middle of the night. The student doesn't take the animal to class because the dog is not providing that service at that time. So again, that's very situational. That's a great example. It's
very situationally based, and in that circumstance, it may be appropriate. But if the dog's not going to class with them, then it darn well better be caged or crated when it's not there and behaving itself. Yeah, that's a good example of the exception to the rule. What you don't want is somebody who says, oh, well, I only need it when I'm uptight. I'm going to take it to certain classes because I've got a problem there. Or I'll take it to classes with me, but I'm not going to take it with me when I go out socially or what. No, doesn't work that way. If they need a service animal in order to support them, they need it. They can't predict when they're going to need that support. Okay. I gave you some wording as to how to say no to an ESA. Let me give you some wording as to how to say no to a service animal, because there will be times when students bring animals to you, or bring animals and say, this is my psychiatric service animal, or this is my service animal now. And it's just not. I helped somebody last week who had somebody who showed up with a 3-month-old puppy that they maintained was trained to provide them with psychiatric service support kind of thing. And they would be training it more over time. And it doesn't even matter what your state laws are regarding service animals and training. A 3-month-old puppy is not appropriate to be in the residence hall. So, or to be on campus. How do you say no to a service animal? This is the wording I would use. The information available to us here does not suggest that your dog is a trained service animal as defined in the Department of Justice guidance. We do not recognize this dog as a trained service animal, and you may not have it on campus. Again, you're falling back to the Department of Justice has defined what a trained service animal is based on the information you provided. And I worded it specifically based on the information available to us here. That means not only what they've said, but what you've observed, or the fact that the damn dog's only 3 months old or whatever. Based on the information available to us here, it does not suggest that your dog is a trained service animal as defined by the Department of Justice. We do not recognize this dog as a trained service animal, and you may not have it on campus. You don't tell them, we think you made it up. You don't tell them it's too young. You don't give them things to argue with you about. You simply say, we understand what a trained service animal is, and we do not believe this animal fits that description. At this point in time, you may not have the dog on campus. Now, obviously, you will expand on that over time because they're going to say, well, when could I bring it? Or what do I have to do for it to? So yeah, you'll expand along the line. But there's the place to start is based on the information available to us, we don't recognize this as a trained service animal and it can't be here now. All right, I see a bunch of questions popping up. Kim?
Yep. Is there a time frame that a self-trained animal needs to have to be able to present the job that they can do? So is there a time frame that a self-trained animal?
Okay. The issue is whether the animal is really doing something effective. But again, going back to what the Department of Justice defines as a trained service animal, legitimate training schools for service animals don't even begin to train the animal to do disability-related tasks until the youngest I've ever seen is 12 months. Usually it's 14 months or thereabouts before they start training the dog to do disability-related tasks. And if they bring you a dog and say, it's 6 months old, but I've got it trained to do what I needed to do, the answer is the information available to us here does not suggest that your dog is a trained service animal as defined by the Department of Justice. And no, we're not going to recognize that. What else?
Student says that their cat is a service animal?
Absolutely not. By definition, by everybody's definition, service animals are dogs. You can just rule that out off the top.
You just answered how old should it be? Can we legally ask for, can we legally ask for from the student?
Oh, what can we legally? All right, let's go back to those 2 questions that we get arguments about all the time. First of all, there's some confusion about what the questions are you can ask. The guidance actually says there are only 2 inquiries. There are only 2 avenues that you can pursue is what they mean. And they say you can ask this and this, but it's really about inquiries that you can make. Is this a service animal trained to provide some disability-related service? That's the first question or inquiry. Is it a trained service animal trained to provide a disability-related service? And the second question is, what disability-related service is the dog trained to do? Not, it helps me feel more comfortable, it brings me comfort, it puts its head on my lap when I'm feeling sad, whatever. The question is, what is the dog trained to do? And if you need to ask further, the dog puts its head on its lap. What is it trained to do to know that it's time to put its head on your lap? because the dog being nice to you is what our pets do all the time. Everybody talks about how their pets know when they're having trouble and are there when they need them, etc. The question is, what has the dog been trained to do that brings that behavior out in them along the way? The problem is that the Department of Justice gave us the 2 questions, but didn't tell us what to do with the answers. So if you've asked the 2 questions, you get a lot of people who get hung up on, first of all, there's a lot of people who ask the wrong second question. If you ask, is the dog trained to provide a disability-related service? You've just made it a yes/no question, and you're up the creek, because if they say yes, you're dead, you're done. No, that's not the question. The question is, what is the dog trained to do? And if the answer doesn't make sense, doesn't fit, doesn't give you what you need, you can then say, what is the dog trained to respond to? What is it that the dog is responding to when they are performing that disability-related service? You can ask more questions if you need to understand what disability-related service is the dog trained to do. If you get somebody who says, you're not allowed to ask me that, you're only allowed to ask me 2 questions, my response would be, I need answers to those 2 questions in order to understand the job that the dog is doing for you. And the information you provided thus far doesn't give me those answers. I'm simply trying to get more information about what the dog is trained to do to provide disability-related support. Let's take the worst case scenario. The worst case scenario is you ask those extra questions, the student says, you can't ask me that, and they go to the Department of Justice and file a complaint because you asked them more than you were supposed to about their service animal. And DOJ shows up on your doorstep and says, what went on here? If I were the institutional attorney, I would say, yes, we did ask those extra questions. We weren't sure, based on the information provided, whether this was appropriately a service animal, and we were trying to get that information. What should we have done in that circumstance? And if DOJ says, oh, all right, yeah, that's fine, you're done. And if DOJ says, you're only allowed to ask those 2 questions, then the attorney says, all right, we'll know in the future, and you move on. People are so afraid that if they ask more than what's there, there's going to be a lawsuit and there's going to be all sorts of problems and they'll get nailed and it's illegal for them to ask. No, this is guidance that is meant to help you provide the information that you need to make decisions along the way. And if you don't have that information, then you ask more questions. And if they come back and say, you shouldn't have asked those questions, then the response is, all right, we won't ask them in the future. And you move on, folks. But you should not feel constrained by what you think you've read on paper. Okay, I saw something flash up. What's the question?
ESA pigeon, or I'm sorry, ESA pigeon. Student narrative supports an ongoing relationship and a need for an ESA. Pigeons carry zoonotic diseases.
Okay. Again, we're not going to get into separating out those pieces. That's for the full class in terms of how you determine whether a request is necessary or not. Just do keep in mind that it's a 2-part process. Approving the student for an ESA, the student establishing that they have a need for therapeutic support and need an ESA is separate from approving a specific ESA to fulfill that role for them. And they need to be kept separate so that you have the freedom to say, yes, you can have an ESA, but not that one.
I believe you answered this in your preface about the 2 questions you can ask. So just repost if you want additional information. Receiving pushback from students and parents regarding rationales, what would be adequate needed to suggest it is a service animal? How should we respond to those inquiries? And I think you may have also answered that.
Well, and again, I would keep going back to the Department of Justice defines a service animal as as an animal that is trained to provide a disability-related service. And this animal, based on the information provided, this doesn't fit that description. I have another quote here that I'm going to send out to you, when you get the student who brings you the certification card or the card that says this is a certified service animal or this is a certified ESA, in response to the certification, there is no certification required or accepted by the federal government. So your certification document is not useful to us in considering your request for an ESA or in establishing the dog's status if it's a service animal. When you get those students who bring you those little cards from the fake service sites that say this is a certified animal, you don't say you just wasted $149. You say there is no certification required or accepted by the federal government, so your certification document is not useful to us in considering your request or in establishing the dog status. You simply say, thanks, but no thanks. There's more that I need to know. Another question?
Yeah, as a comment, I think, can we establish some language to refer to the two different types of training we're talking about? First one is a high-level advanced obedience training. Second would be a disability-related task training.
Okay. By DOJ definition, the only training that they recognize for a trained service animal is disability-related task training. The high-level obedience training has nothing to do with a service animal for a person with a disability. It is assumed that by the time the dog becomes a trained service animal, trained to provide disability-related tasks, that it will be obedient and that its behavior is under control. But that has nothing to, that training is irrelevant to status of the dog as a disability-related service animal.
Okay, are you allowed to ask about the source of the training and to see if it was professionally?
Okay, quick answer there. No, you are not allowed to ask. The answer is no. There are times when, depending on circumstances and depending on how much they volunteer along the line, you may be able to ask some questions that help you clarify who the trainer was and whatever, because they say, oh, well, I had it trained at so-and-so. And if they bring it up and you said, what kind of training was that along the line, you could probably get away with that with no problem, but you're not allowed to challenge them by when they say it's a trained staff or service animal by saying, oh yeah, who trained it? What was it trained to do?
The last one is when the student says the dog is trained, we can ask about the specific task, but we cannot delve into the specific training. The student who reports they trained the animal to respond to X, Y, or Z.
Okay, they say they train the animal to respond to X, Y, or Z. My question is, what is the animal trained to do? What is it that the dog is responding to? I am allowed to ask what task the dog is trained to provide or what task the dog does. And that means knowing what it is that happens on the part of the individual that the student is, that the dog is responding to. I'm not sure I explained that well, but it's as close as I can get to saying, I don't think you should be afraid to ask questions from service dogs that you know are not service dogs that have to do with what the animal is trained to do. You can ask specifically about the task. You can't ask who trained them, but you can ask what they were trained to do. And you should be asking those questions, because the ones that are, that used to be ESAs, and now all of a sudden they're going to be psychiatric service animals, the answer is going to be things like they come over and they lean against me when I'm having a panic attack, or they stick around and they provide me with comfort. An animal, go back to that DOJ definition, an animal whose sole purpose is to provide emotional support and comfort is not a service animal. Why? Because they're not trained to respond to a trigger. They are simply responding to the general feeling that the individual has. That's not a service animal. You need to ask what they are trained to do in response to what. That's a trained service animal. Okay. Among the questions when I sent it out to you this week and said, well, what else do you want to know? Somebody asked about behavior. What's acceptable behavior on the part of a service animal, general service animal or psychiatric service animal? And the answer is The DOJ only lists two things. The DOJ says it is not acceptable if the dog isn't potty trained, isn't housebroken. And it says that the animal must be under handler control at all times. Expand on that second piece, must be under handler control at all times. That means that the dog cannot be disruptive in whatever setting it's in, which, by the way, is why I've never heard anybody legitimately say that they had somebody who wanted to bring a service horse to campus, because a miniature horse is going to be disruptive on campus, is going to be disruptive in the classroom. Back to the student who claimed that they had a service cat. No, a service cat is going to be disruptive on campus. They're not meant to be there. They're not accepted as being there. Okay. If the animal's, certainly if the animal isn't housebroken, it can't be there. If the animal is not under handler control at all times, that's a problem. And if you've got somebody who lets their service animal wander in the cafeteria, or if the animal is being aggressive towards others or towards other animals, that's a problem. It's also a problem if the animal is simply disruptive by its behavior. You don't throw a service dog off campus because it yawned really loudly in the middle of one class. But if the animal is constantly nudging at people and disrupting and being a dog, that's part of why you don't want a younger puppy as a service animal, because they're going to do puppy things, and those puppy things are going to be disruptive in the setting. Let's try it this way. We have always made it clear to students that their right to be in the educational setting, even with their disability, does not supersede the right of every other student to be in that educational setting and making full use of it. So if the student's behavior is disruptive to the educational process, it can't be allowed to continue. The same is true of the dog. In this case, the dog is an extension of the person. And if the dog is engaging in behaviors that are on an ongoing basis disruptive of the educational setting and the climate that it's in, then the dog can't be there. It doesn't mean it's not a service dog. That's not the argument you're having. You simply say it cannot be in this setting because it is not behaving in a way that is acceptable for a trained service animal. Okay, other things on my list. How do you respond to the all of a sudden service animal in training? The kid who gets turned down for the ESA on Friday and shows up with the same dog on Monday and says, service animal in training. We're not going into the state law issues here, but we do that in the class. But there are things that you need to know about your state law that will help you in that regard, as far as knowing what you can say and what limits you can put on it. For example, just last week, somebody had a student who showed up with the dog the next day and said, well, I'm going to train it to be my service animal. Service animals in training are protected under their state law, except their state law says that service animals in training are service animals who are being trained for people who are blind, deaf, or in a wheelchair. It specifically says hearing dogs, guide dogs, or dogs for people with mobility impairments, which means that her, quote, service dog in training to be a psychiatric service animal isn't covered under state law. So there's lots of ways of dealing with those issues when they arise. You need to know what the rules are. But the bottom line is that I said in the notes that service animals, psychiatric service animals, almost never start out as ESAs. Why not? Because ESAs, by definition, are proposed because they want them in the residence hall because they make them feel more comfortable and more grounded and are better able to keep in the to manage in the residence hall. That doesn't suggest a level of disability that would require the intervention of a psychiatric service dog out and about and on their way. If the dog was chosen to keep them company in the dorm, it is unlikely that it is an appropriate animal to be trained to provide some specific disability-related service on the outside. And remember too, that the documentation needed to establish need for an ESA is very different than the substantial limitations that would be necessary for somebody to get a service dog. All right, we've got like 2 minutes before we have to cut off. Quick questions?
Yeah.
Okay. All right. Trying to think if I have anything else in my notes. I say no to a service animal. Okay, let me just recap real quickly then. ESAs are for the residence hall. You can say no to an ESA. You need to be sure, you need to be differentiating between, is this the person who needs an ESA? And if so, what ESA are they going to have? That's a two-step process along the line. And there are rules regarding what you can and what you can say yes to and what you're entitled to say no to when it comes to what that ESA should be. Service animals are dogs that are trained to provide a disability-related service. They are specifically trained to the individual. It can be self-trained. It is unlikely that somebody can self-train a psychiatric service animal. If that's the issue that comes up, you don't argue in terms of that isn't a psychiatric service animal because you've trained it yourself. The issue is, based on what we've seen, this is not a trained service animal as defined by the DOJ. We don't recognize it as such. It can't be here. Behaviorally, while I am not in favor of giving people a pass who say they have a service dog just because they say it, there are times when there is enough information provided and where there is enough question about whether or not it's appropriate that it may be easier for you to allow the animal to be there with some very clear understanding of this is appropriate behaviors for a service animal and for you with the service animal. And if you violate those rules, we are going to have you remove the animal from campus. In other words, even if it's not a real service animal, if it's not creating any problems, if it's behaving itself and behaving as if it were a service animal, I'm not sure you've lost anything by letting it be. So a lot of this comes down to judgment calls on your part. Okay, I absolutely promised Kim that we would stop at 1 o'clock. For those of you who are on the call now, if you want to continue this conversation on the listserv, I'm going to get offline and get on the list right away and we can continue there. For those of you who are watching the video after the fact, you know where to find me if you need me, janejarrow@aol.com. Please don't hesitate. I hope this was useful for you. Okay, we're done.
I'll provide Jane with the recording and take good care.
All right. Thanks, everybody. Take care.